More than 2 weeks after its launch, problems are plaguing the rollout of the Affordable Care Act, of course better known as Obamacare.
And beyond the political rhetoric, there's some concern that not enough is being done. Chris Van Cleve in our newsroom tonight to explain where things stand right now. Chris?
Well, Leon, from a numbers standpoint, it's hard to really answer that because getting updated numbers isn't easy. As of last Friday in Maryland, the state says a little over 1,100 people enrolled. D.C.'s only released the first week of numbers there. 89 people asked to be invoiced for a health care plan. As for Healthcare.gov, this one right here that Virginia and the bulk of the country is using, the White House is refusing to give any numbers at all. And frankly, it's not even clear if the website works.
I'm very disappointed. That's the big word for me today, is just plain disappointment.
Johnny Wood's been at his desk in Fredericksburg trying to use Healthcare.gov to buy insurance since October 1st.
I've made about 75 to 100 attempts over a 17-day period.
After all that, he still hasn't been able to compare plans, let alone enroll. Instead, he and Americans across the country have been stopped by glitches, error messages asking to try again, and requests for patience.
As far as putting together a program, I find it unconscionable that something that of this magnitude was failed so miserably.
They've had 3.5 years to get this right. The technology is not getting it right, and I think that's inexcusable.
Obamacare is not just a website. It is the website is simply a portal into a virtual marketplace.
But Healthcare.gov was intended to be the primary way for people in 36 states to shop for and buy insurance mandated under Obamacare. The site has not worked properly, even after the administration announced it would be taken offline during off-peak hours for maintenance.
But there's no question that that work is not done and that there are still problems and we need to get them fixed.
The White House won't say when those problems will be fixed, but for Wood, perhaps a reason to be optimistic. Just today, he was able to save his data on the site for the first time, but he still can't shop for insurance because he's waiting for his identity to be verified.
It's starting to frustrate me.
He is a very patient man. That verification process remains one of the main stopping points for people. Now, Congress wants these problems explained. As for numbers, HHS will release figures for the first month of Healthcare.gov next month. D.C. plans fresh numbers on Monday and then will update monthly. Maryland is releasing data every Friday. We're tracking it. We'll continue tracking it. Live in the newsroom, Chris Van Cleve, ABC 7 News.